Hi everyone, my name's Heidi. I'm a clinical instructor for St. Joe's Women's, and I wanted to say hi, and I hope everyone's doing well and taking care of themselves, staying safe. Today I want to talk about bronchopulmonary dysplasia, or BPD. So BPD is a form of chronic lung disease that affects our newborns. Usually the newborns are born prematurely and require oxygen therapy for a significant amount of time. With BPD, the lungs and airways of the bronchi are damaged, which causes destruction of the tissue, or what we call dysplasia, in the alveoli. Babies are not born with BPD. BPD is usually caused by mechanical ventilation and long-term use of oxygen therapy. The severity of BPD can vary from infant to infant, and the more premature the baby, the greater risk of developing BPD. Some causes of BPD is a result of the newborn's lungs not developing normally while the baby is growing in utero, or not developing fully if the baby is born prematurely. The lungs are very fragile and can be easily irritated or inflamed after birth, and this can be done with mechanical ventilatory support or high levels FI2 or infection. With the ventilator, it's necessary for certain patients. It helps the patients to survive, but the high pressure can make or irritate and harm the lungs. For this reason, we try not to use it if it's not necessary, or try to wean it off as soon as possible. High levels of oxygen helps the baby's lungs and helps the body to receive oxygen to work to its full capacity, but high levels of O2 can inflame the lining of the lungs and injure the airway. High levels of O2 can also slow lung development in a preemie baby. Infections also can inflame the lungs, causing the airways to narrow, in turn making it harder for premature babies to breathe. Infections also cause an increased use of O2 and increase the amount of breathing support that a patient may need. This is a picture of just some damaged lungs in a neonate, which takes a long time for them to heal. Different conditions can affect the growth of the fetus during pregnancy and can also lead to premature labor. Needle infections, or a mother smoking, using drugs, or preeclampsia, an inflammation of the fetal membranes, or what we call chorioamnitis, can cause BPD. After birth, RDS, or what we call respiratory distress syndrome, is closely tied to the development of BPD, but only in some infants with RDS will develop BPD. Having a patent ductus arteriosus, or what we call a PDA, which is a heart defect in which the blood vessels that connect the right and the left side of the heart do not close after birth, may lead to BPD in the baby if it's put on a ventilator and had to be on there long term. How BPD affects the body. So BPD causes damage to the alveoli, the current ones and the developing ones. The tiny blood vessels surrounding the alveoli may be affected, which can make the passage of blood through the lungs harder. The lower the amount of working alveoli, the longer the infant may need to remain on a ventilator, which can cause further damage to the lungs. Over time, increased pressure inside the blood vessels in the lungs and between the heart and the lungs can cause pulmonary hypertension. In worst cases, heart failure can occur, and babies who have BPD may also have issues feeding and developmental delays. Who's at risk for BPD? So obviously the level of prematurity in a baby is what mostly puts a child at risk for developing BPD. Most of the babies that develop bronchopulmonary dysplasia are born greater than 10 weeks early. They typically weigh less than 2 pounds at birth, and they're born with respiratory or breathing problems. It's rare for an infant who's born after 32 weeks gestation to develop BPD. And if infections occur before or shortly after birth, it can contribute to a baby developing the disease. Our numbers of babies who have BPD are higher these days because we're saving more premature babies, and our science is better, so they survive. Some symptoms of BPD are, well, they vary from patient to patient, and they are also based on the severity of the disease, but most commonly, they are tachypnic, or they are breathing fast. They're labored breathing with retractions, or what we call retractions. They can be either subcostally, intercostally, substernal, supraclavicular, or one or all of the above. As they get older, they tend to wheeze or have reactive airways. The need for continuous oxygen therapy after the age of 36 weeks gestation, and they can have difficulty feeding. Repeat lung infections are also a symptom, and they may require hospitalization. Babies who have severe BPD may be or have more trouble feeding, which can lead to delayed growth, or also can develop pulmonary hypertension, which is the increased pressure in the pulmonary arteries, or cor pulmonale, which is the failure of the right side of the heart. The consistent high blood pressure in the pulmonary arteries or in the lower right chamber of the heart causes this condition. Diagnosing BPD. So this is based on the clinical evaluation, the degree of prematurity, and the need for oxygen after a certain age. BPD is diagnosed when a baby is born more than 10 weeks early and is still needing oxygen therapy by the time they reach their original due date. BPD can be mild, moderate, or severe. This depends on how much extra oxygen a baby needs at the time of its original due date and how long the baby may require oxygen therapy. The physicians also may order some diagnostic tests to help them with the diagnosis. They usually use chest x-rays, which they're looking for inflammation or infection in the lung, which is seen in severe cases. They also order labs, usually the ABG, looking for obviously the pH, CO2 retention, and the amount of oxygen in the blood. CBC also looks for infection. An echocardiogram, and this is to rule out heart defects or pulmonary hypertension. Trying to prevent BPD. So a baby born after the lungs are fully developed is the best prevention. Healthy pregnancy practices can increase the likelihood. Mothers should avoid smoking, alcohol, and drug use. They should try and eat right. Prevent infections and see doctor regularly. If there is a risk of developing or delivering prematurely, a mom may receive injections of steroids or betamethasone. This medicine speeds up the development of the baby's lung ability to make surfactant, and usually it's 2 doses if we know in time. This can lower the risk of the baby developing RDS. For treatment, there's no specific cure for BPD. However, the treatment focuses on minimizing further lung damage and providing support for their lungs and allowing them to heal and grow. Types of drugs that are typically used are diuretics. This drug helps to decrease the amount of fluid in or around the alveoli. Bronchodilators, which we all know, help relax the muscles around the air passages, which makes breathing easier. Corticosteroids reduces and prevents inflammation within the lungs, helps reduce swelling in the trachea, and can decrease the amount of mucus that is produced. Viral immunizations. Kids with BPD are at increased risk for respiratory tract infections, especially RSV. Babies with moderate to severe BPD receive monthly injections with a medication that helps prevent RSV during RSV season. Cardiac medication is used in severe cases. This medication helps to relax the muscles around the blood vessels in the lungs, allowing the blood to pass easier and reduce the work on the heart. Treatment of BPD usually includes breathing support with a nasal CPAP and or a ventilator, as well as oxygen, and until the lungs start producing enough surfactant. As the BPD improves, babies are weaned off nasal CPAP or ventilators until they are breathing on their own. but will likely need O2 support for a while. Some supportive treatments would be checking their fluid intake, also checking their pulmonary artery pressures with echocardiograms. We're also doing ABGs to check the amount of oxygen in their blood. We give them fluid and nutrients, as nutrition is crucial to their growth and development of their lungs, as well as obtaining vital signs regularly. Severe BPDers may be hospitalized for several months and may end up needing a tracheostomy. This is able to provide them with long-term vent support, allows them to go home and try to have some semblance of a normal life. The tracheostomy also allows them to interact with others and work on other skills. Physical therapy is also used. It helps strengthen their muscles. It helps for them to clear mucus out of their lungs. And BPDers tend to be very hypertonic. So physical therapy, helping them stretch out their arms and legs, helps to lengthen those muscles, helps to stretch them out so they're not so contracted. Managing BPD is a big thing after the patient goes home. It causes most of its trouble during the infancy and early childhood, and the symptoms tend to be up until they're about 2 or 3 years of age when they start to recede. Treatment tends to end about 5 years of age typically. There are some cases that are shorter and obviously some that can be longer. However, the lungs may not develop normally, which can cause lung issues later in life. Regular checkups, vaccinations, and seeing a pediatric pulmonologist are a must during the first few years of life. Many infants with BPD will experience apnea, and they are typically sent home on like a pulse ox apnea monitor, so the parents are aware of that. Feeding problems that may require a feeding tube or a G tube. They tend to have GERD, pulmonary hypertension, neurologic complications, vision issues, and that's typically because they may require high concentration of FiO2, which in turn causes ROP or retinopathy of prematurity. They can have hearing problems and learning disabilities. Most are rare in babies with mild BPD. After discharge, growth may still be delayed and can continue to experience lung problems into adulthood. Many people have had BPD as babies, may develop reactive airway disease or asthma, and can struggle with exercise intolerance. They may also be more susceptible to infections like colds and the flu, and their symptoms may be more severe. And they may take longer to recover. Frequent trips to hospitals are common, especially in those who have moderate to severe BPD. Trying to prevent infection by washing your hands, discouraging visits from sick family or friends if you have a baby with BPD at home, as well as not smoking at home, making sure your child is vaccinated, and calling the child's doctor if you have any signs of respiratory infection are very important. I hope everybody is going to stay safe, and I hope to see everybody very soon, either at the hospital or out and about working. Thank you so much, and I hope you have a great day.